All right, I already checked my order. I have an order to put in an NG tube. So I have all my supplies here, everything that I would need. So I'd come in, I would wash my hands, provide for privacy, knock, knock, knock. Hi Bob, my name's Michelle, I'm gonna be your student nurse today. And I have an order to place an NG. Can I have your name and date of birth? And he gives that to me. Do you have any allergies I should be aware of? He says no, nothing to skin prep or anything like that. He says no. All right, have you ever had an NG placed? He says no. So what this is, it'll go into your nose, down your throat and into your stomach. Do you have any questions about that? He says no. It's a little uncomfortable, but once it's done, it'll be all over with and we don't have to worry about it. So we'll try to go as quick and easy as we can. So are you gonna be able to hold still for me? He says yes. And so I'm just gonna get a few things ready here. So I'd wanna make sure he's in high Fowler's, which he is, so that is good. I'd wanna make sure my suction is good. We want it on lower minute, and I would check that to make sure it is patent and working. I would wanna give him a towel just to put over him so we don't get anything on his linens. An emesis basin, some Kleenex, so we want to keep that up there. So once my supplies are ready, I already got some tape ready, but I would want to inspect his nares. We want to make sure that everything's good and clear for our insertion. We don't want anything to get in the way. We want a nice good line in. So I'm just going to put some gloves on and get that ready. And we'd also want to check for a gag reflex because we're going to have them swallow some water. So I'd want to put a tongue depressor in and use that and check if they had a gag reflex. And Bob does, so he's good to swallow. If they were NPO, we would not want them to swallow, so we'd have to modify that. So since that is all good, I'm going to use a pen light and I'm going to inspect his nares. I'll have him hyperextend his neck. And I'm just going to inspect his nares, make sure they're nice and clear. Ask him if he ever had trauma or if he has a deviated septum, because that could change the way we do this. I would compress one nostril and have him breathe through the other and do the same. And whichever one has the best airflow, that's the one that we'll use. So we'll be using our right nostril. So I'm just going to get a few more things ready. I would want to put skin prep on, and this here is going to help the tape to stick. So I would remove my gloves since skin prep is so sticky. Wash my hands again because I took my gloves off. And then at this time, since I already have my tape ready, I'm going to get my tubing ready. So I'll put a pair of gloves on for that because I don't want to be touching it with my bare hands. You'd want to check your order depending on what tubing you would use. So I pull this out. Alright, and then we would want to measure. We would like to go from the nose behind the ear to the xiphoid process to make sure we get it in the correct area. So we'll mark this with a little piece of tape so we know exactly where we're going and not a little bit too short or too much. And then we would want to lubricate this. Don't want too much on there. And then what I'll have my client do, I will have them hyperextend their neck. And I'm going to go in with the curved side down. And we don't want to let this go, so we'll go into the nasopharynx, to the oropharynx, and once we reach that, we'll have him lean forward the best he can, not letting go. We'll have him take little sips of water, and each sip he takes will advance another 5 to 10 centimeters, making sure we don't meet any resistance, that he's tolerating that. If he were to gag, I would stop, withdraw slightly, have him take another sip, but he tolerated this very well. So I want to put some tape on the bridge of his nose just to make sure this is nice and secure. We definitely don't want this coming off. And then at this time, I could also take another piece of tape if I wanted to and put it around here and secure it to his gown with the safety pin. So I would take my gloves off, wash my hands again. How you doing, Bob? He says, very good. Once the tube is inserted, you would not want to hook it up to suction. You'd want to verify that it is in the correct place. So this facility requires x-ray along with most, but if it didn't, I could always use a syringe and withdraw and test it with pH paper, and we'd want that less than 5.5. So once our placement has been verified, we would want to connect our tubing to suction once it has been verified by x-ray, because you don't want to connect it until it's been verified by x-ray or by other means, because you don't want it going into the wrong place. So our suction is still good, so we will connect that. Make sure he's nice and comfortable. Let me just wash my hands again. And if he was on any oxygen, I would adjust the cannula or apply a mask if that was indicated to do so. At this time, I would discard of my supplies in the correct area. Make sure if he was a pediatric patient, I would definitely want a parent there, just to make sure that they were comfortable, and because it can be a traumatic experience and not a very comfortable one at that. I would want to check my patient for respiratory distress and do a frequent respiratory assessment, just to ensure that everything's still working properly. And I would want to document the date, the time, my name, initials, any assessment information. I would want to document how my client responded and the verification of the x-ray. And I believe that is it.